We are live from the State Health Operations Center in Smyrna, Delaware. This morning we're joined by Dr. Odom Walker, Secretary of the Delaware Department of Health and Social Services, and Dr. Karyl Rattay, Director of the Delaware Division of Public Health. Good morning.
Good morning.
Good morning. Thank you so much for joining us here virtually to talk about coronavirus and certainly our responses and part of how we're getting to a new normal. We are planning to offer this kind of update over Facebook Live weekly, including time to answer some of your questions. You can send them to us now or virtually ahead of time. Today, I know we're all experiencing a profound shock to our sense of normalcy, and it was only 7 days ago we announced Delaware had our first positive case of coronavirus. And since then, we've seen public schools close. Governor Carney issued a state of emergency where places of worship discontinued services. Bars and casinos were closed. Restaurants were ordered to offer only takeout and delivery. In 7 days, our way of life has changed dramatically, from the way we do our jobs to the amount of time we spend in our homes, secluded from others. This pandemic has quickly changed the very routines of our lives. Today, I'm asking all of you to do more. We need to act as if we might be carrying the virus. We can't risk infecting the most vulnerable populations, including seniors and people with chronic underlying health conditions. Here's why. The coronavirus is 10 times more deadly than the seasonal flu. And for most of us, it'll feel very different. If we get, or maybe when we get coronavirus, COVID-19, we might feel sick, but we'll recover and we'll be fine. But seniors and people with heart conditions, lung disease, and diabetes are at the highest risk for suffering a serious illness or even death from this virus. None of us can afford to be out in the public unnecessarily because we might transmit the virus to those vulnerable people. And that's why we put in these precautions and public safety measures. We don't have much time left to try to flatten the curve. And certainly the thought is we will all behave differently in our normal everyday lives. That is truly how we will help flatten the curve in Delaware. I'm going to have Dr. Rattay talk a bit about our situational update, and we do plan to put out updates about numbers and how to get tested, but we hope to be able to give you some good information about what your new normal may be in this current situation, including talking about testing and closures, but also give you a little bit of background on the course of the virus. Dr. Rattay.
Great, thank you. So as of right now, we have 19 confirmed cases of coronavirus disease in Delaware. 17 of those from Newcastle County, 1 in Sussex County, and we are announcing our first patient in Kent County as well. And sadly, this individual is critically ill. We continue to make contact with these individuals and to monitor their health. Now, more than ever, it is crucial that we all take the steps that are needed to take care of our own personal health as well as help and protect all of those around us. Most importantly, if you are sick, especially with fever, or cough, or shortness of breath, do not leave your home. And whether you think that you have been exposed to someone with coronavirus or not, it is critically important that you stay home. Do not go out and expose yourself to others, particularly the most vulnerable of us, including older Delawareans and those with chronic health conditions. If you are ill, please call your healthcare provider. Don't just show up in the emergency department. Please call your healthcare provider for guidance and testing recommendations. We are very pleased to be working with Delaware hospitals across the state, and over the upcoming days you will see more testing options available for those with symptoms in our state. So let's talk about if you are well. As Dr. Walker was saying, if you are well, you still should act as though you have the virus. That's why it's so important for you to social distance, which means stay at least 6 feet away from anyone else. It's important for all of us, whether you're in that high-risk group or not, to make sure that you are taking care of your own physical and mental well-being, and we'll talk a little bit more about that. But I think what's most important is we, as Delawareans, need to come together and take care of ourselves and each other more than ever.
So we can go right into the questions, and thank you again for sending them in to us.
Anne Marie Hobson asks if we know how long a carrier without symptoms can carry the virus, or more about kind of how the virus is transmitted.
So we should definitely talk about the course of symptoms and the course of this virus.
Yeah, so as we've been saying all along, there's a lot of unknowns around this virus. And so, we talk about what we do know, but I think we all have to acknowledge that there's a lot that's unknown at this point. Now, whether there are carriers or people spreading the virus without symptoms is not clear. There have been some rare cases, but again, we all have to behave as though we have the virus. When a case becomes positive or when a person starts to develop symptoms, we look back for 48 hours prior to that person developing symptoms to see who they've made contact with in that time period. So we look at an incubation period, we call it, from a time of exposure to 14 days is that time period for which somebody could develop symptoms, and that's the time period for which we want people to especially quarantine themselves from others if they have been exposed.
That's right. And so I think it's really important to think about that point of exposure in your everyday contact of who you're around, to make sure that we're thinking about cleaning surfaces, washing your hands, trying to avoid touching your face and your eyes, because that is a common way. You touch a doorknob or you hand someone money, and that could be a way that you are infecting yourself unintentionally. So we really want people to think about that. The CDC has put out guidance that they think it's very unusual for asymptomatic people, that is people with absolutely no symptoms, to transmit this virus, but we really don't know. And what we have seen is some people who have coronavirus feel differently than others. Some just get a mild sore throat and some achiness and a fever, and others get more serious respiratory problems where they're having shortness of breath. So we want to make sure that you know what you can do to not only take care of yourself and your loved ones, but also act in your normal course of business whether you're at the grocery store or running an errand, getting gas, to make sure you're washing your hands frequently.
Yeah.
What other questions do we
Can you
have?
speak about some of the, we've had a number of questions about kind of the symptoms, and maybe define a little better what a fever is, since that is considered one of the symptoms?
Absolutely. So if you don't have a thermometer now, please go out and get one. And you can use any kind of thermometer, and some of them come in Celsius or Fahrenheit. 38 degrees Celsius is the number that we use in the medical community. Often they're in Celsius, but in Fahrenheit that typically is 101.7 or higher. And so we do want you to make sure that you are checking your temperature. And some people in the healthcare sector should check their temperature morning and night, twice a day, just to see whether they may be developing any symptoms, particularly if you've been taking care of someone who may have been exposed. So I think that, again, thinking about getting that thermometer, if you have loved ones, there are different types of thermometers that are out there. You're a pediatrician, there might be other things to think about for young people that we have used, the ear ones or the forehead ones. They all work.
Yeah. And also important symptoms include cough or shortness of breath. And one thing I've been thinking about a bit, I personally have seasonal allergies, which I think most Delawareans do. And this is a really good time to get on top of your seasonal allergies, talk to your doctor about that, so that you don't get confused between whether I have allergies or coronavirus.
Marianne Palmieri says, no thermometers can be found. Do you have recommendations for what people can do if they can't find a thermometer? Or there's some recommendations you might have?
Absolutely. Continue to look back. I think that right now, because of all the closures in the media, there is a sense that there will be no thermometers ever again. Continue to make phone calls and check around. There are also inexpensive kinds of strips that are out there that are being produced in greater quantities. And so that is another opportunity for you to definitely continue to reach out to your stores and pharmacies.
And if they can't find one, but they're concerned they have symptoms, do you have some recommendations for how they should respond?
Yeah, I mean, if you feel like you have a fever and you have symptoms, call your doctor or call our call line to talk to somebody.
NAB Vets asks, is it possible to recontract COVID-19 after recovering from it the first time?
It's a great question. Not clear. That's one of the things we don't know about this virus. A lot of experts think that it's unlikely, but there was a publication a few days ago that suggested an individual may have become reinfected. So it is certainly something that we are looking at.
And we're learning a lot about what the body's response is to this virus. And so I think, again, you'll see stories and reports that come out from one case study or one situation, and I think there's a lot to be learned right now. It's unclear about reinfection, about what happens with infants. We've gotten a lot of questions about kids and seniors as well, and we're still, again, learning a lot about how different populations respond to this virus.
We noticed that you're doing the best you can to do some social distancing from behind the table here. We had a question from somebody who's in their 70s and is healthy, and they want to know, is it okay for them to go outside for a walk?
Love that question. And I think that's really important. In fact, a good friend of mine reached out to me yesterday and said she wanted to walk and ride her bike, and her family was telling her she's not allowed to. You can. In fact, we really want to encourage people to go for walks. Our parks are open and free for, I believe, all of April. You got to social distance. So you got to stay at least 6 feet away from individuals. And of course, if you are ill, and that's for anyone, please don't leave your house. I know I've already said that, but going for a walk at a time like this is a really positive thing to do for our mental and our physical health. We just got to make sure we social distance.
And it's going to rain for a few days, so today is a good day to get out and about. And again, that's going for a walk, just sitting outside. It could be going to a park or just doing something you enjoy, going for a bike ride. We just really want to underscore that.
We had a couple of questions, people asking about how they can practice social distancing if their departments or businesses aren't closed. Do you have some recommendations for some good practices that people can use to keep themselves safe?
Absolutely. So we, again, whether it's at home, at the grocery store, we're really recommending be in a room that has no more than 50 people. Kind of that same guidance is important. Make sure that there's good air circulation around and that you are able to maintain some distance. So if you really aren't able to be with it, more than 6 feet apart, sort of the 2 arms length apart, we really recommend you kind of rearrange your work area. And then make sure that you are practicing good hygiene, that you have wipes around and you have hand sanitizer, and avoid shaking hands. And certainly if you have to cover a cough, sneeze, or any of those other things due to seasonal allergies, make sure that you're washing your hands afterwards.
Yeah, I mean, we know that people are, going to need to continue to go to some public places to get food or prescriptions or other essential items. And, I think emphasizing the hygiene piece of this is important. Before you enter a public place, making sure you clean your hands. Even, throughout your time shopping, clean your hands. Don't touch your face as soon as you depart a store. Clean your hands again. The more diligent we can be with that, the safer.
Any final thoughts or words of wisdom for the public during these trying times?
We know that this is a challenging time for a lot of people, and we'd love to say that it's just for a few days, but this may be a way that we need to adapt to living our lives for a while. And so it's really important that we do everything we can to listen to what is being advised, pay attention. As Dr. Walker was saying, we've got to heed this call to action to all of us, social distancing, taking care of ourselves and our loved ones as best as possible.
And I think this is a time where we really have to be a community that cares for the most vulnerable. So if you can check on your neighbors, make sure that you're making phone calls and you're trying to see who may really need help with getting their medications or getting to a place that's difficult for them. I think that'll be really important. And we have seen the nonprofit community come together to try to think about how to make sure that our kids are being fed when they're not in school and that they have access to educational opportunities virtually. I think we're going to continue to see Delaware respond well, but it really does require everybody coming together. So thank you for staying informed. Please continue to send us your questions. We have lots of resources at de.gov/coronavirus, whether it's posters or information or frequently asked questions. And stay tuned. We will do this at least weekly, and there are other virtual opportunities to hear more about what's going on in Delaware.
Dr. Walker, Dr. Rattay, thank you for your time.
Thank you.
Thank you.